one of Hercules' labor was to change the behavior of adults, he would have probably failed it. Most people reject altering their lifestyles. While there are trailblazers and early adopters, they represent only a fraction of the population. Most companies introduce gadgets that mimic the functionality of devices people already wear on their wrists, or ask to adopt apps which are carbon copy of what people already have. Less than a quarter of smartwatches are being used for anything health related. At REVital, we focus on bridging the gap between smart technologies and healthcare providers. Rather than asking users to change their lifestyle or invest in new devices, we leverage what they already have, their wearables. Our software as a service solution takes the data collected from users' devices and transforms it into meaningful insights. Doctors can see trends and changes in patient health, particularly heart rate variability over time. That allows them to predict and prevent health crises well before they happen. By using the data from the same device worn by the same patient, we can calculate personalized averages and circadian rhythms. This information is then safely and securely delivered to the healthcare professional, providing them with historical data on heart rate and activity. The market is already substantial in both Czechia and Germany, particularly among people 40 to 55 years old. More and more companies seek healthcare benefits to improve the well-being of their employees to reduce workforce turnover. The coverage of remote patient monitoring by healthcare insurances is expanding in more countries each year. REVital generates revenue through a monthly subscription of €14.99, whilst doctors are being paid for every active patient on the system. With more than 60 years of combined experience in tech, data science, and art, we have released products used around the world. Security, anonymity, and data protection are integral components of all our solutions. REVital's advisory board has medical professionals ranging from general practitioners to the head of palliative care department in the largest hospital in Czechia. We have a GP signed up for a system and are exploring potential partnerships with more doctors. Rubik Garage has assisted us in refining our pricing model and market approach. There are discussions with several VCs for potential investments. REVital is currently fundraising to initiate a targeted marketing campaign and expand our sales team. There are promising candidates interested in joining us. Our goal is to ensure that personal data is not wasted, but instead is used to improve people's lives. I am Tori Master, CEO of REVital. Thank you for your time.